the gastric in the stomach, and then the intestinal phase. So the gastrocephalic phase is just simply when your digestive process can start without actually physically putting food like fruit snacks in your mouth. You can smell them. That can initiate the secretion of saliva. Thinking about food can start the process. The initial taste activates certain parts of your cerebral cortex, hypothalamus, brainstem, to prepare your body for digestion. That's why you get like hunger pains before you even eat, because your body is already secreting the digestive enzymes to digest the food. So this is specifically listing different nerves. Facial nerve, glossopharyngeal, stimulates the secretion of saliva, and then the vagus nerve stimulates the secretion of gastric juice. Once the food does reach the stomach, which doesn't take long to go from the back of the throat to the stomach. I mean, like 4 to 8 seconds for larger things, and liquids get there within a second. Then we got gastric phase. The hormone that's released in the stomach is called gastrin. Promotes the secretion of the gastric juice and increases the motility. Once the food gets to the small intestine, the first part is called the duodenum, then the intestinal phase begins. And there's hormones involved as well. So more anatomy here, just the oral cavity. Another name for it is the buccal cavity, because you got those muscles in that area formed by the cheeks, the hard palate and the soft palate behind it, and the tongue. Mastication just means chewing. Mixes that food with the saliva. Remember, the food needs to be dissolved in the saliva for you to be able to taste it and smell it. Once it's swallowed, the food is now referred to as a bolus. A chemical digestion of the food starts in the mouth, and it's due to few enzymes. One is amylase, which acts on starch, so carbohydrates, to start digesting the carbohydrates. You actually, in your saliva, you actually have different ions, IgAs, immune system antibody. So protection. And lysozyme, actually, it's a bacteriolytic enzyme that kills certain bacteria, not the good bacteria in your mouth. And then also there's lipase, which helps dissolve fats, but it's not activated until it hits your stomach, actually. And then this is talking about the different types of salivary glands. You actually have 3. The large salivary glands are called the parotids. And then underneath your tongue, sublingual glands, which are salivary glands, and you have submandibular glands. The average secretion of saliva a day, this is kind of gross, 1 to 1.5 liters. Think of a 2 liter of pop. So it's half of that for sure, if not more. What controls it? Talked about this in the nervous system, but the parasympathetic autonomic system is when that's activated, your rest and digest nervous system, you're going to have increased saliva. Touch, smell, taste, they stimulate you to secrete saliva. When the sympathetic or fight or flight system is activated, you decrease the amount of saliva. The tongue, it's skeletal muscle. We have voluntary control when we use it to speak, obviously, but for digestion, it's helping to move that food around in your mouth, helping with the swallowing. That's called degglutination. We have a few sets of muscles in the tongue. Extrinsic, move the tongue from side to side. Intrinsic, actually are in the tongue and alter the tongue's shape and size for speech and swallowing. Here's the mouth. Fabulous. We got teeth in there. We got a uvula. We got some frenulums, like that attach those little pieces of tissue that attach the tongue underneath. You actually have one up there as well. If somebody has too tightly tied a lingual frenulum, they're called tongue-tied. Little kids, because they might notice it when you have a baby someday. They can't stick their tongue out very well. They might not be able to nurse very well. That's called tongue-tied. They can clip it. Doctors can if they feel that it's needed, because it's your tongue as well with eating, which would be important for a newborn to be able to nurse, but it's also involved in speech, which you want your tongue to have fluid movement for speech. And then we can see the teeth. There's a difference between baby teeth, how many there are, 20, and then adult teeth, 32. The teeth are located in sockets of the alveolar processes of the mandible and maxilla, and they're lined. So the teeth themselves are lined by this ligament, periodontal ligament, which is full of dense, fibrous connective tissue that anchors the teeth into the socket, which was a shock absorber during chewing. 3 main parts of the teeth: the crown, what you see, the root connecting the two parts, the root is beneath the gums, and then the neck in between. And we got the gingivae or gums, which kind of dip down into each socket. Gingivitis, of course, is an infection of the gums. Dentin is more strong than bone itself, and even stronger than dentin is enamel. So dentin, most of the tooth underneath the white part here is that dentin. And then harder than that even is enamel that covers the dentin. The pulp cavity is like in the middle of that tooth, and it's full. You can see here blood vessels. We got nerves, or we even have lymphatic vessels in there. And at the bottom, where they exit in the root, it's called the apical foramen. If you were to get a root canal, which I have had one before, unfortunately, they actually come in, make a hole, they remove all of this pulp cavity, clean it out, fill it up, so nothing is in there anymore. Your tooth is pretty much dead. They leave it in there though, and then they recover it with a new crown. You get a crown. So they put a cap on your tooth, a crown. And I have 3 of those, I think, or 2. I don't remember. Lucky me. So here's 20 baby teeth. So, and they start around 6 months of age. You get the incisors, the central incisors usually first, and then the top incisors, and then the lateral incisors. And then you lose them. You actually get cuspids and bicuspids and the little premolars right there. Then you lose them between 6 and 12 years, and then you get your permanent teeth. You get the baby teeth replaced, 20 replaced, and then you get 12 more that are the molars, the first, second, third molars. Yeah. The third molars are your wisdom teeth. The first molars you get around age 6 to 7, and the second one, maybe around 10. Forget the exact age there. So teeth. You chew up your food with your teeth, then you swallow it. That's called degglutination. It has a fancy name. What happens is, okay, so we got the throat back there. We know the air goes through the throat and also food. So oral pharynx is in the back of the oral cavity, laryngopharynx. When you swallow food, your uvula, your soft palate actually move upward to prevent food from coming out your nose. And when you swallow, also your epiglottis covers your trachea. We have many muscles in this area. We have voluntary, involuntary controls in there. 3 stages of degglutination. Voluntary, that means you choose to swallow. And then pharyngeal, what's happening in the throat to the esophagus, and esophagus from the esophagus to the stomach. The first one is voluntary control. The next 2 are involuntary. So that's the voluntary act of swallowing. Pharyngeal stage, that bolus in the back of the mouth goes into the esophagus. And that's what I mentioned about the epiglottis there, closing off the the trachea. Esophageal stage. So here's our bolus. The bolus is moving downward. Once the bolus is into the esophagus, peristaltic waves, the go-gurt, coordinated contractions, pushing that food down. We got the 2 layers of muscles that are contracting and pushing that bolus onward. Really the only digestive function of the esophagus, you can see it there, is to move the food down, propulse it, not repulse, but propulse it. It's a muscular tube, and it punches through the diaphragm at an area called the esophageal hiatus, and it goes into the stomach. The lining, this is a cool picture showing the wall. This is the wall of the esophagus. This is the lumen of the esophagus and the different layers. We see their names. This is the stratified squamous epithelium. We got some muscle in here, some more muscle there. The superior third is skeletal muscle, and the latter is a smooth muscle. The upper and lower esophageal sphincters. Remember, sphincters are just little muscles, essentially, that can contract and tighten to prevent things going through and relax, to let things through. So the upper one is closer to the top of the esophagus to move the food from the pharynx into the esophagus, and the lower esophageal sphincter moves the food from the esophagus into the stomach. So down here, okay? So here it's relaxed, food's going through, boom, into the stomach. So sometimes people, their lower esophageal sphincter doesn't work as well as it should. So it actually lets food and acid from the stomach leak into the esophagus, maybe after a large meal, or if you lay down right after you eat. Sometimes just sitting up, doing normal stuff, eating foods that are higher in acidic content, coffee, alcohol, foods with a hot tomato or citrus bases irritates that area, and the acid along with some of the food moves up and irritates the esophagus. This is called heartburn, or gastroesophageal reflux disease, GERD. It's called heartburn because it's in the area where the heart is located, so it feels like your heart hurts, but it's actually not. It can be treated with, there's some pills that reduce the acidity of the stomach, or lessening the citrusy or low acidic foods you eat, or you can maybe not lay down right after you eat. Would be a few good things you could implement. Then the food is in the stomach. Hurrah! The stomach, with nothing in it, is about the size of a sausage in this J shape. So here's the esophagus. Here's the first part of the small intestine. This is the inside of it, what it looks like. It has these little ridges called rugae. Where the stomach lies can vary, just depend on the activity of the diaphragm. Inhalation pulls it superiorly, so up. Oh, yeah, with each exhalation. So it kind of moves a little bit when you're breathing. And it's the most distendable organ of the GI tract, meaning it can get bigger and smaller depending on what's in it. Now, we don't want food to go into the stomach and then out right away. That would not be best for your body. So the stomach is best for a holding, kind of a reservoir to help digest the food before it moves into the small intestine. Because we can eat more quickly than the intestines can digest and absorb it. So the stomach needs to hold on to it and push it into the small intestines when they're ready for it. It has the same linings of the digestive system that we talked about before, with a few little add-ons. Like, for example, it has 3 layers of the muscle, because it does a lot of mechanical digestion. There's 4 main regions of the stomach. The cardiac region right here, the